Joyce Barton, and I live in Chattanooga, Tennessee, and I have been a patient of Dr. Bernard's. I heard about CSMO, and I was having major problems with my right knee. It would kind of give on me, and I decided that I would go and see what could be done about it, and I was sent to Dr. Bernard. He is very humanistic. He just really treats you like you're a person, not just a patient or a number on a chart. And he explained to me exactly what we would do. And so I went into the hospital, and before the surgery, he came in, he talked to me again, making sure that this is what I wanted to do, making sure I knew exactly what he was going to do. And the surgery was done, and I was sent up to my room after going through the waking up area. The first day I was kind of out of it. I was just totally gone. And the next day, on the second day, they started doing exercise with me and getting me up and doing things. He cares. He, honest to Pete, cares about his patients. When I went to have the stitches out, that was a funny thing that happened also. They couldn't get one out, and it was being very stubborn, so he came and he got it out. He says, "This is going to hurt." And he says, "You want to pinch me?" And I said, "No, I don't want to pinch you." He said, "You just want to hold my hand and squeeze it." And I said, "Yeah." So he gave me his hand, and I squeezed his hand the whole time he was taking it out. And it did hurt. It hurt really, really, really bad. But he was very patient, very slow, and very meticulous about what he was doing. And when it was time for me to leave the hospital, he gave me choices. He said, "You can go home, and home health care can come several times a week and work with you. Or, and this is what I would advise you to do, but it is your decision, that you would go to a rehab center, and they will work with you on a daily basis, and you will get the exercise that you need, and you will heal a whole lot faster." And so that's what I decided to do. And the place that I went was Life Care. They were awesome. They took me to his office when I needed to go to the office, and everything worked out perfectly. Everybody's like, "I cannot believe that you are walking as well as you do. I cannot believe that you are getting the motion that you're getting." But number one, I gave it to Dr. Bernard because he knew the right thing for me to do. And number two, Life Care people knew what I needed to do, and they worked with me diligently to get me to where I could walk. And even now, you can't tell I have an artificial knee. It's just, I walk like everybody else, and I feel like everybody else. So I'm very, very pleased with my surgery. I'm eventually going to have the left one done, and trust me, no one will do it but my Dr. Bernard.